Okay, on this video I'm going to go over Ali's case study and just go over the document itself. So Ali is a 42-year-old male, and we can see he's on no medication, and then he's currently taking basically just B12, vitamin D3, and vitamin K. Now, his chief complaints, number one, he lists is gut issues. I never have proper full bowel movement. I have to use lots of toilet paper, not only after the bowel movement, but also multiple times during the day to make sure I'm clean. So, by the way, I highlighted the things that I think were relevant here. I don't know, I could read everything too, but I'll just highlight some of the key points. So this is definitely, right away, an enteric nervous system issue. So when people have impaired smooth muscle contractions of their gut, they just feel like they can't stay clean. And, when people get older, they may even have anal leakage or things that way. But this is definitely a smooth muscle enteric nervous system issue. Now, he goes on to say, in the past, I experienced that when I'm on antibiotics, my bowel movements improve significantly. That's characteristic of small intestinal bacterial overgrowth. I even remember having complete normal bowel movements while I was on antibiotics. So right off the first couple sentences, we can see that he's got impairment of his gut nervous system, the enteric nervous system, and this is expressing itself really now as small intestinal bacterial overgrowth. Remember, when the enteric nervous system, the nervous system of the gut, is injured, impaired, or dysfunctional, there's inability to properly close the ileocecal valve, the valve between the small and large intestine, and bacteria in the large intestine, which is found in large populations, translocates or moves into the small intestine. And then anytime someone eats anything that has any kind of carbohydrates or sugars in there, they get the distension and bloating. And they feel dramatically better when they take antibiotics because it gets rid of that small intestine bacterial overgrowth that's there. So then he goes on to say, as soon as they start adding veggies, they go back to having complete bowel movements. And remember, with small intestinal bacterial overgrowths, they get the bacteria species, when it gets exposed to fructose oligosaccharides and different sugars, it'll release things like methane and hydrogen. And methane can actually decrease bowel motility. Hydrogen can increase bowel motility. So there's different expressions with different people. But in his case, the bacterial species are probably producing gases just that shuts down his bowel motility altogether. So there's still really a couple of things that happen that slow down bowel activity in small intestinal bacterial overgrowth. One is in some type of dysfunction in the enteric nervous system, and two, the methane gas itself can slow down intestinal smooth muscle contractions. And then he goes, saying sometimes that I can't properly digest my meals. So right away we know we have something here. And when you see these enteric nervous system disorders, you're thinking about, how did the enteric nervous system get injured? And was there an inflammatory intestinal disease that's been there for a long time, like undiagnosed celiac disease, undiagnosed ulcerative colitis? Do they have a severe intestinal infection? They have any kind of surgery that may have injured the nerve plexus? Is it a brain-to-gut axis disorder? Those are all possibilities. Now, here we start to see fatigue, brain fog, and depression. So maybe it is a brain-gut axis disorder, or maybe it's a gut-brain axis disorder. So maybe a combination of both. So he goes on to say, other chief complaint: I might be very well for a week with lots of drive, motivation, and energy, but suddenly I crash and have to rest, unable to do my day-to-day tasks. Physical activity seems to improve the situation, though sometimes it causes me to crash too. Saying that when I have extreme fatigue, it is hard for me to do any physical activity due to lack of energy and motivation. So there's something really causing the brain to lose its endurance, right? So it's exceeding his brain's metabolic capacity. So this is something to think about. What are the variables and factors that impact brain mitochondrial function, energy pathways, and so forth? And then he goes on to say, I tried a water fast, then carnivore for a week. I felt great. And this is related to brain fog. So some of these gut to brain mechanisms are involved here. And, basically he's basically on a restricted foods on a FODMAP diet, being on a carnivore diet or just being on a water fast. So there's no fructooligosaccharides and monosaccharides that are supporting bacterial overgrowth in the small intestine. However, he goes on, I added some cooked spinach, and next morning I could actually feel something's off with my brain and body aches. So the expressions he has when he adds in things like spinach and vegetables and fruits is, typically distension and bloating with the chief complaint with SIBO, small intestinal bacterial overgrowth, but with him it's getting cognitive impairments, right? So these bacterial species in the gut, when they get fed with sugars and start to become metabolically active and promote fermentation, they also produce lipopolysaccharides, and these lipopolysaccharides can impact neurochemical pathways in the brain and shut down the brain mitochondria, so you can have reduced brain endurance, which may be happening here. So we got to figure out what part of his fatigue and brain depression is really just related to his diet and his whole SIBO presentation that may be there. So those are important to look at. Then he talks about a scar not healing. And then when I was 9 years old, I used to chew my lower lip badly playing video games. I stopped chewing my lips. There's a scar there. I'm not sure what that's really all about. And then he's got some sinus issues. So some types of immune dysregulation, immune activation, antigen triggers that may play a role. And then he goes on to his detailed narrative history. And it's not always that clear, but we can get some clues of what's happening somewhat in a timeline fashion. But, you look at this, you see right away that, first of all, he was on antibiotics like for everything. So there could have been some, early disruption of his microbiome that is expressing itself into adulthood. And then he was diagnosed with epilepsy. And he was on phenobarbital, which is basically a medication that decreases excitability of neurons to control seizures. And it's actually appropriate because if people have, kids have seizures, and if they're serious, significant seizures, they can actually cause some injury to the brain every time they have a seizure. And people have epilepsy. If you look at the pathophysiology of epilepsy and seizures, there's basically genetic pathophysiology in which there's abnormal excitability of neurons. So it's not that like there's a region of the brain that's not working. It's just the neurochemical activity and the excitability of neurons are prone to be in a hyperexcitable state. So we can see that he's got some of these genetic variations there. And then if you read out a little bit further, you can see just, his brain is not developing the way it should. So he's having some problems with developing calligraphy. These are right parietal lobe integration functions and its development also with the motor system. So he's having some problems there. And he's not engaging in physical activities because the worry about injuring his head, which means he's not developing his coordination system and motor system. So you have to see with the exam if he has any patterns of coordination, integration, and so forth. And then he goes on that he stopped his medication at some point, and when he stopped his seizure medications, he stopped wetting himself. He's during his sleep. Okay, so a lot of times when people have, basically what happens is when there's decreased activation of the frontal lobe to the micturition centers, you can have basically bedwetting. Now, you can also have bedwetting if there's severe fecal impaction that's putting pressure on the bladder. That's the most common cause for kids having bedwetting. But basically, there's some impacts of probably the anti-seizure medications decreasing activation of his brainstem micturition centers that were leading to some bedwetting when he stopped the medication. Those resolved. And when we see those, you got to be really suspective of frontal lobe dysfunctions. The frontal lobe is the main pathway to that micturition center. Then he goes to the same age, started to develop OCD-like behavior, locking and unlocking doors multiple times. So this is, another childhood developmental disorder. And difficulty with memorizing, handwriting changes. So we're seeing some child developmental disorders there. But he was able to finish his bachelor's degree in computer science, so that's great. And then some issues with diet. They started developing pain in his knees. Some inflammatory conditions there. Now, alopecia areata is basically an autoimmune disease of hair follicles. So now we're seeing the expression of an autoimmune disease here. And, he went through this dietary journey. Autoimmune, paleo diet, gluten-free diet seemed to make a big impact on his symptoms. There were some changes in his alopecia. Wasn't completely gone, but that seemed to be a factor. And then 2005, he really found, the FODMAP diet had an impact. It started to make the correlation between different foods that can impact his gut and mood function. And, those are some significant things there. Now here in 2013, you're seeing he's very sensitive to chemicals. So this is where you start worrying about losing his chemical tolerance. So now that you see the alopecia, you can see that he's got some autoimmune mechanism with hair follicles, now which is loss of self-tolerance. Now you see loss of chemical tolerance. And, some of these cascades starting. So we have probably some childhood developmental disorders, some brain region disorder mechanisms, some neurochemical imbalances associated with epileptic activity, which are genetically based in combination with autoimmunity turning on that may be impacting his enteric nervous system. So this is a case where it's complex. There's several layers of things that are happening. And then 2015 he gets some severe depression that starts to take place. He's got some dizziness and lightheadedness. So we got to figure out if he's got any kind of central cerebellar or vestibular disorder, or what the cause of his dizziness is. And then he goes, strange thing about colonoscopy. So right after he had a colonoscopy, he was extremely happy, energetic, positive. So with a lot of people that don't have healthy enteric nervous system function, they actually do better when they do have some kind of colon irrigation and some colon hydrotherapy to clean out their bowels. He seems to have some improvements with that. And then he apparently reads my brain book, my thyroid book. He investigates. It seems like he then figures out he's got Hashimoto's. Then he goes through and does a GI test and go into those pathways. And then we get a list of, also, by the way, he's got some S1 injury. So we'll have to do an exam, make sure that's okay. And back in 2019, he had severe episodes of depression, motivation issues. Yoga seemed to really help him. Yoga is going to be receptor activation. It helps activate proprioceptive inputs to the brain. So that's interesting to notice there. He can't do high intensity activity. We don't know if that's metabolically, that he's getting an overtraining syndrome by not having antioxidant systems to protect him, or his brain just can't handle that degree of activity because he's got developmental issues his whole life and coordination issues, and he needs to do slow integrated inputs like yoga. So we'll have to see what's going on with that. Now, if we look at his list of diagnoses here, so he has the epilepsy here, so this is genetic, and this is going to be something that is going to impact a person throughout their whole life. So I would say some of his symptoms may be related to neurodevelopment issues related to changes in neuron excitability patterns that are dysfunctional in epilepsy. And then we see he has an H. pylori infection, alopecia areata turns on. This is an autoimmune disorder against hair follicles. He gets a kidney stone. Then he gets diagnosed in Hashimoto's. You see the autoimmune disease progression. 2004 is the first indication. 2017 we see another autoimmune disease. And then H. pylori Epstein-Barr. And then, when you look at things that have caused reaction, right? L-glutamine specifically causes insomnia. However, I probably need to replicate this to be sure. So, sometimes people blame everything on supplements. We got to see if this is really a factor. I mean, if he does have small intestinal bacterial overgrowth and enteric nervous system permeability, he's going to have some degree of intestinal permeability. So we want to, on an ongoing basis until he, unless there's a mechanism that we can do, if we can figure out to help his enteric nervous system. But a lot of times these enteric nervous system patterns are permanently damaged and injured, and there's an ongoing need to follow the guidelines of a FODMAP diet and to constantly support intestinal permeability. And L-glutamine is very effective, so we have to see if this is actually there. These days I avoid most supplements to make sure I can maintain 4 to 5 hours of sleep. So we got to see what this connection is with supplements and how they impact his sleep patterns here. Then we have a list of labs which are in the case review. SIBO test, this says it's negative, but actually if you look at the test that he included, it is definitely positive. So it's just the way the lab is determined, borderline versus abnormal test that I can show you there. He's got some Cyrex gluteomorphin responses. His IgA levels seem to be always low. He's got Cyrex that shows antibodies to the thyroid, TPO. This is shown on multiple patterns. He's got arthritic patterns, some history of some joint pain. So he's got some probably early RA. Myelin antibodies could be another mechanism where his gut nervous system gets destroyed. This can maybe causing his brain-gut patterns, his brain-gut symptoms. His gut symptoms are definitely enteric nervous system, and he's got some brain symptoms, so maybe some neurological autoimmune patterns going on. And then he's got some, anti-gliadin markers, zonulin leaky gut markers, abnormal cortisol markers, homocysteine elevations that seem to show up. Okay. So it seems like, when you kind of look at his case history, we get like one layer after another layer after another layer. People that have epilepsy, they can grow out of their seizure activity, but they have a genetically different neuron. And they're prone to neurodevelopmental delays, which he definitely has. And it seems like, those neurodevelopmental delays have progressed into adulthood to some degree. And we got some brain-gut axis disorders, and his gut disorder is really an enteric nervous system issue, which is now leading to patterns like SIBO, and that SIBO pattern is now causing brain fog. I mean, those are the impressions you get from this. Now, when we look at this brain health nutrition assessment form, the section 1 are symptoms related to just circulation. So he's got fungal growth on toenails, tip of the nose is cold. So he does have some significant symptoms of his brain just crashing, and people that have poor circulation may have some issues with endurance. We have to really look at his capillary refill times, look at his temperature of his proximal to distal, see how his circulation is, look at his perfusion index, see if he's got any patterns that may be impacting blood flow to his brain, which could be a factor in why he just shuts down and has low brain endurance. And then he's got some symptoms of low blood sugar, waking up in the middle of the night, eating large meals in the morning. Maybe he loaded up on L-glutamine that was sweet, with some kind of sweetener that really caused him to have these hypoglycemic events, and that's why he thinks he can't take L-glutamine. Maybe it's a blood sugar issue. We have to look at that more. He's got some patterns of insulin resistance, fatigue after meals. Some of that may not be insulin. It just may be the fact that he's getting an immune response to some of the foods he's eating. Difficulty digesting foods, difficulty digesting protein-rich foods, brain fatigue when the body's inflamed. Those are pretty obvious from the history. Here you see, these are all, section 10, are all the symptoms of low serotonin. You see these with major depressive disorders, but feelings of sadness for no reason, loss of pleasure in hobbies and interest. Now, a key feature of low serotonin is people just don't get pleasure from the things they like to do. So people that have like low serotonin, and they go like, what's your favorite meal? They can't think of it. They don't care. What's your favorite song? They can't think of it. They don't care what the song is. So nothing that used to bring them joy, like a favorite movie, a favorite song, seeing a good friend, they have no impact on causing joy for them. Those are very characteristic of low serotonin. And then he's got a little bit of, some other slight neurotransmitter imbalances, but these are pretty characteristic of low serotonin activity. Now, when we look at the brain region localization form, we can definitely see, lots of frontal lobe symptoms here. This section here is all the frontal lobe, prefrontal area. This is where you have executive functions. Now, listen, most people should have 0 to 1s. When you start to see 3s and 4s, meaning they have symptoms 75% of the time, it is an absolute problem. So I highlighted things that were 3s or 4s, and just when you highlight things that are 3s or 4s, you can quickly see different regions that are not working well. So multiple areas of 3s and 4s indicate this frontal lobe is not functioning very well. He probably has never really developed it. He's probably had some developmental delays with his genetic epileptiform seizure type neuron activity that's there. So he's got some issues with that. Now, obviously, he was able to accomplish ability to finish a bachelor's in computer science. So, he does have the ability to get through that. So that's good. But it seems like he has these episodes where he just crashes when you read his history. Speech area seems to be impacted when his brain's not functioning. So we definitely want to look at a thorough neurological exam with him. Some memory issues that seem to come up. Dizziness, neck basal, so some issues with his cerebellum function. So we definitely want to check Romberg's, check to see if he's got smooth movements, if he's got any patterns of dysdiadochokinesia. Then we see some OCD patterns and some dysautonomia patterns that are there. He gets these sudden emotions, and if you look at these are epileptiform activities. So epileptiform activity means spontaneous firing of neurons. So have you ever been diagnosed with seizure disorder? Yes. Have you been diagnosed with epilepsy? Yes. Have you ever been told you seem frozen, absent, or turned on with any recollection of time? Those are seizures. Yes. Have you ever experienced sudden muscle stiffness or rigidity throughout the body? Yes. Have you ever experienced sudden muscle jerks throughout the body? Yes. So clearly we have epileptiform or seizure-like activity. Do you ever experience sudden emotional responses, anxiety, sadness, or crying for no reason, laughing, and then we get autonomic symptoms. But you see all these different yeses that are here. So this is all characteristic of spontaneous firing of neurons. And in his case, we clearly know he's got patterns of epilepsy, and you can see it here. So his brain and his neuron function genetically are not as efficient and are prone to fatigue and spontaneous activity that we have to understand. And listen, like these types of patterns, you're not going to give him magnesium and fix it. It's not a nutrient deficiency. It's a genetic neurosynaptic inefficiency. Okay. Now, if we look here, we can see again lots of gut symptoms, leaky gut symptoms, small intestinal bacterial symptoms, digestive enzyme symptoms. He's got some thyroid symptoms here, some andropause symptoms, and then as we look at the neurotransmitter assessment form, mostly what we see is, again, this is overlap very similar to the other form, but low serotonin symptoms as well. Okay. And then here we can see he's not taking any medication. There's just some imaging, lots of imaging here of looking at his abdomen. It seems like they were looking to see if there's any abdominal disorders or cysts or kidney things. We need to figure this out more about the history. But, screening of his abdomen for any kind of lesions or pathology showed that everything was clear. Now here you can see that he did a small intestinal bacterial overgrowth test. And if you look at his levels of hydrogen in gray and methane, you can see, during different times, 20 minutes, 40 minutes, 60 minutes, 80 minutes, 100 minutes, 120 minutes, they're all fine, right? These levels should be under 20. And right at 160 and 180, boom, you see that spike here of hydrogen. And as hydrogen levels go up, blue is just combined hydrogen and methane, but that is dysfunctional. Now the way this lab reports it is they're calling this negative, but they also write increase of hydrogen greater than 20 over the lowest preceding value within the first 100 minutes after indicates bacterial overgrowth. So when they look at these levels, they classify the criteria that they're using for borderline, which most labs would consider positive. But this is absolutely indication of small intestinal bacterial overgrowth. You shouldn't get a huge spike of hydrogen here like that. It should all kind of be the same all the way through. So we definitely see some abnormalities here that fit the criteria for even this lab's borderline, but with most labs would be a positive test. Then we see gluteomorphin. Gluteomorphin is the opioid that immune reaction to gluten. This can definitely cause mood disorders. So we see some of those patterns there. Then when you look at his food sensitivity profile, you don't see any significant abnormalities. He's not having patterns of what you call like immune tolerance issues. They're all kind of within the normal reference range. I mean, there's possibly kind of immune globulin deficiency, and these are all false negatives, but we have to look at the rest of the panel. Here we can see he clearly has markers for Hashimoto's, arthritic peptide for RA, and myelin basic protein. He listed that earlier. So this would explain some neurological symptoms. This would explain any kind of joint pain, inflammation. This would explain any thyroid symptoms. If you look at his labs, he doesn't seem to have hypothyroidism yet, but literature shows clearly when you have these antibodies, it's just a period of time before you develop Hashimoto's. No significant reactions to all these different food proteins. So we don't see any significant loss of immune tolerance or food sensitivity issues. And people that have immune suppression, like a lot of times you just see less than on these markers. Here they're, like if you look at basal, it's the range is 0.2 to 1.8 there. It's like right at 0.61, kind of right in the middle here. And with a lot of these markers, he's, within the lower end of or midline levels. So it's not like they're depressed systems. So I don't know if these are false negatives. So it's just a few food reactions, nothing too bad. So most of his food reactions are most likely related to the small intestinal bacterial overgrowth, not necessarily to food sensitivities, seems like here. Here you see a GI map test that was done, and basically you just see, you see a positive H. pylori test. We got to see what's happening with that. And you see basically patterns of dysbiosis, just an imbalance between good and opportunistic bacteria. This protozoa here is not going to be cause of all of symptoms. And when was this test done? This was done. This test was done 2018, and he's had these symptoms now for since he was almost 12 years, 13 years. It's not going to be that protozoa that causes that for 13 years. And then as we go through, they do some more imaging of his abdomen. Nothing there. You see a positive thyroid antibodies, ultrasound of the neck. They find some nodules, but nothing significant. 2 millimeter nodules at age 42. It's no big deal. That's common to see. They're benign nodules. They do some testing for Epstein-Barr. This is just past infection. These aren't an indication of anything new. Cytomegalovirus. These are just past infections. Nothing significant. As you see, these IgGs. Some studies show like a large percent of the population is up to 90% of the population is Epstein-Barr IgG levels that are high. A large percent of the population is IgG, cytomegalovirus that's high. I don't really think it's just a waste of a panel. Here we can see his cortisol levels. His cortisol levels are not going up in the morning. So we got some cortisol rhythm issues. Now listen, if you focus your care just on this adrenal profile, you're going to waste a lot of time. It is way more complicated than some type of adrenal imbalance. That's there. His male hormone profiles here, you can see they're all, pretty much within normal reference range. His androstenedione is 142. That's no big deal. SIGA is high. You'll see these levels high or low at different lab tests, which just means the immune system is functioning. Another GI map test, dysbiosis. It's like, would you do this again? It's going to show dysbiosis because of his diet. And then we look at the blood test. It's interesting, so these are like wasting an entire page on just one blood test. Vitamin D levels here. When this test was done, 2018. If you look at this, a lot of these lab tests are about 4 years old. So we definitely need to get some updated lab tests. Homocysteine levels are okay. 4 years ago, he didn't have any patterns of anemia. Nothing really significant with these blood tests so far. He's got a slight MTHFR gene that may impact his homocysteine levels. We have to check that. His homocysteine levels here seem okay. I think there was a history somewhere he wrote where they were elevated. That could be related to his MTHFR genotype susceptibility. And then, again, another dysbiosis test, basically showing the same thing. Now here you can see when this test was done, there was some Ig immunoglobulin imbalances, a little bit slight IgM. And then if the rest of the panel doesn't really show us much. Basically, some routine lab test. So I think what's significant when you look at this case review is basically the fact that there is a genetic history of epilepsy and seizure responses. There's a clear pattern of small intestinal bacterial overgrowth, a dysfunctional enteric nervous system, which may be related to a developmental delay. When you look at the pathophysiology of autism, you just have neurons that don't migrate properly. So they have ongoing neurodevelopment patterns all the way into adulthood, and they have gut and brain-gut axis disorders their whole life even. And this may be somewhat similar to that. He may have not had proper neurodevelopment, proper neuromigration, and now as he's getting older, that in combination with myelin antibodies and aging is really making these brain-gut axis disorders express more. But I can tell you, just looking at this case, with someone with epilepsy and seizures that's happening, this is not going to be a case where you're going to find a nutrient that's going to cure and fix everything. This is actually probably not even going to be a case where the diagnosis is really complex. It hasn't been figured out. I think the diagnosis is pretty clear of some genetic variabilities with epilepsy and seizure and some small intestinal bacterial overgrowth. You're not going to put this patient on a gut protocol and see everything fixed. More than likely, we have to figure out how to improve his function, ideally, so he has better quality of life. And that would be a realistic goal. And I think if that's not done, and we keep trying to search for things and try one protocol after the protocol, which seems like everyone else has been doing, it's just going to be a waste of time. So we have to figure out, with his gut issues, with his brain issues, how to optimize it. And I think that would be a realistic goal. Now, when we do a medical history and we go through a physical exam, we can have a better understanding of what's happening. But that's the initial impression I have with the case review. I hope that's helpful to you.